Good day, our dear viewers. Today we'll be tackling the deliberative nursing process theory by Ida Jean Orlando. It is expected that we'll be discussing her biography, the overview of the nursing process, the goal, the major concepts, sub-concepts, assumptions, and the 5 stages of the nursing process. So to start with the presentation proper, let us know more of the theorist. Who is Ida Jean Orlando? Ida Jean was the first generation Irish American born in 1926. She is an internationally known psychiatric health nurse, theorist, and researcher who developed the deliberative nursing process theory. She dedicated her life to studying nursing and graduated in 1947 and received a Bachelor of Science degree in Public Health Nursing in 1951. In 1954, she completed her Master of Arts in Mental Health Consultation. While studying, she also worked intermittently and sometimes concurrently as a staff nurse in OB, MS, ER as a general hospital supervisor and as an assistant director and a teacher of several courses. And in 1961, she was married to Robert Pelletier and lived in Boston area. After working as a researcher, she wrote a book on her findings from Yale entitled The Dynamic Nurse-Patient Relationship, Function, Process, and Principles. Her book was published in 1961. A year later, she also continued her research studies and published her second book, The Discipline and Teaching of Nursing Process, in 1972. Ida Jean Orlando retired from nursing in 1992 after becoming well-educated, researching over 2,000 nurse-patient interactions, and coming up with a theory that changed nursing. She was recognized as a living legend by the Massachusetts Registered Nurse Association. The deliberative nursing process of Ida Jean Orlando is set in motion by the behavior of the patient. She proposed that patients have their own meanings and interpretations of situations, and therefore, nurses must validate their inferences and analyses with patients before concluding. She also described her model as revolving around the following 5 major interrelated concepts: the function of professional nursing, presenting behavior, immediate reaction, nursing process discipline, and improvement. Ida Jean Orlando's goal is to develop a theory of effective nursing practice. The theory explains that nurses' role is to find out and meet the patient's immediate need for help. According to the theory, all patient behavior can be a cry for help. Through this, the nurse's job is to determine the nature of the patient's distress and provide the help he or she needs.
Ida Jean Orlando only included 3 major concepts: the person, the health, and nursing. Orlando uses the concept of human as she emphasizes individuality and the dynamic nature of the nurse-patient relationship. In Orlando's theory, health is replaced by a sense of helplessness as the initiator of a necessity for nursing. Orlando speaks of nursing as unique and independent in its concerns for an individual's need for help in an immediate situation. Ida Jean Orlando described her model as revolving around the following 5 major interrelated concepts. The organization principle refers to the function of professional nursing. This means finding out and meeting the patient's immediate need for help. Orlando pointed out that nursing is responsive to individuals who suffer or who anticipate a sense of helplessness. In presenting behavior, it is the patient's problematic situation. The nurse finds the patient's immediate need for help, regardless of how the presenting behavior appears. It may represent a cry for help for the patient. The immediate reaction is the internal response. The 5 causes of the patient perceives acquire automatic thought that stimulates automatic feeling, causing the patient to act. These 3 items are the patient's immediate response. The nurse's reaction is stimulated by the patient's behavior, which is the beginning of the nursing process discipline. Automatic nursing actions are nursing actions decided upon for reasons other than the patient's immediate need. Deliberative nursing actions are actions decided upon after ascertaining a need and then meeting this need. Nursing process discipline is the investigation into the patient's need. The nurse needs to explore the patient's condition and observe the action for the patient from what the nurse will say or do to determine if the nurse's reaction to the patient is correct, helpful, or appropriate. The nurse is the one to identify the appropriate action in cooperating with the patient. If the action results in a positive outcome, the nurse is successful in completing the process. Improvement is the resolution to the patient's situation. In the resolution, the nurse's actions are not evaluated, but the result of his or her actions is evaluated to determine if their action helped the patient meet their needs. The nurse repeats learning how he or she can help the patient. Assumptions of Ida Jean Orlando. When patients cannot cope with their needs on their own, they become distressed by feelings of hopelessness. In its professional character, nursing adds to the distress of the patient. Patients are unique and individual in how they respond. The deliberative nursing process has 5 stages. The assessment, in which commonly known as check-up, is to determine what the patient is feeling. The assessment stage, the nurse completes a holistic assessment of the patient's needs. This is done without taking the reason for the encounter into consideration. The nurse uses a nursing framework to collect both subjective and objective data about the patient. The diagnosis is done with the help of information from the assessment. The nature of illness is identified. The diagnosis stage uses the nurse's clinical judgment about health problems. Diagnosis can be confirmed using links to defining characteristics, related factors, and risk factors found in the patient's assessment. Outcome identification and planning. The planning stage addresses each of the problems identified in the diagnosis. Each problem is given a specific goal or outcome, and each goal or outcome is given nursing interventions to help achieve the goal. By the end of this stage, the nurse will have a nursing care plan. The implementation. The nurse carry out the patient's need. In the implementation stage, the nurse begins using the nursing care plan. The evaluation stage. The nurse looks at the patient's progress toward the goals set in the nursing care plan. Changes can be made to the nursing care plan based on how well or poorly the patient is progressing toward the goals. If any new problems are identified in the evaluation stage, they can be addressed and the process starts over again for those specific problems. The nurse is continuously exploring the reaction of the patient to determine the appropriate action to fulfill the need of the patient. In conclusion, Orlando views nursing's professional function as finding out and meeting immediate need for help. The theory focuses on how to produce improvement in the patient's behavior. Evidence of relieving the patient's distress is seen as positive changes in the patient's observable behavior. The deliberative nursing process helps nurses achieve more successful patient outcomes such as fall reduction. Orlando's theory remains a most effective practice theory that is especially helpful to new nurses as they begin their practice.